Here's what you should know about oppositional defiant disorder. I'm Dr. Terry Bennett, a child and adolescent psychiatrist and associate professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University. Oppositional defiant disorder, or ODD, is a persistent and regular pattern of mood and behavior experienced by about 3 to 10% of kids and teens. Kids with ODD have a very hard time with anger and irritability, intense patterns of arguing or defiance, and trouble letting go of negative feelings. This pattern of hostility is more intense and frequent than typical toddler tantrums or adolescent moodiness. It happens weekly to daily for at least 6 months and negatively affects a child's family, school, and social life. One common misperception about oppositional defiant disorder is that it means that kids are either bad or sick. First, it's not about being bad. It's more accurate and helpful to think about these kids as being less skillful in managing their impulses, big emotions, and day-to-day stressors. Most kids with ODD also experience other conditions like attention deficit hyperactivity disorder, or ADHD, and anxiety or sadness. Kids with these challenges are more likely to experience stress in their everyday lives, including in their families, schools, and neighborhoods, compared to those without ODD. This saps their ability to manage big negative feelings. Second, ODD is more like a pattern of emotions and behaviors than an illness. Research has shown that children with ODD tend to become stuck in patterns of interaction called coercive cycles. They often respond negatively to requests or a situation. Adults sometimes respond with their own, less helpful emotional reactions, like anger or backing down from requests, especially when feeling tired or overstretched. With time, these child and adult behaviors can reinforce each other. These patterns can then spill over into parts of kids' lives, including friendships or school. Families often feel exhausted by this cycle and sometimes hopeless about change. One big advancement in understanding ODD is learning that we need an ecological approach. This means supporting kids within their families, schools, and communities. In addition to treating co-occurring conditions like ADHD or anxiety, we also want to support families with evidence-based, positive, and mindful parenting programs that interrupt negative cycles and help soothe stressed out kids.